آه، بداية بطلب منكم تفضلا بالدعاء لفقيدنا الدكتور علي أحمد سيد والدكتور محمد فتحي أمين. هنتكلم عن المانجمنت اوف ديستال تيبيا كيستر ارتيكولار المانجمنت by expert tibial nail versus minimally invasive percutaneous plate osteosynthesis. We will answer the question: is there a difference between the expert tibial nail and MIPO in management of this fracture? Through a study was done by our department under supervision of Dr. Said. هنتكلم عن introduction بسيط، الكلاسيفيكيشن والامبلانتس اللي احنا استخدمناها والتكنيكس اوف internal fixation. هنتكلم عن الاستادي بتاعتنا وهنتكلم عن الريزلتس والكيس برزنتيشن والكونكلوجن. Introduction: التيبيا is subcutaneous bone with minimally covered by soft tissue, highly vulnerable to local soft tissue compromise and breakdown. A tibia fracture is the most common long bone fracture, while extra-articular distal tibia accounting for 3% to 10% of all tibial fracture that translate into 0.6% of all fractures. Distal tibia fracture pose unique challenge to their anatomical proximity to the ankle joint, bounded by thin soft tissue envelope and high incidence of bone comminution. The classification, according to AO molar classification, the distal tibia segment was referred as 43 and subgrouped into A1, which is simple fracture, A2, which is wedge fracture, and A3, which is the comminuted fracture. Implants. Our study was done by plates. There are different types of plates of distal tibia. One with mallular tab, and the other without the mallular tab. These are varieties of distal tibia plate. In nails في الconventional nail وفي الاكسبرت nail. الاكسبرت nail بيوفر لنا allow the proximal and distal segment to be controlled through placement of multiple angulated proximal and distal interlocking screw within a small distance. وده بيفقدوا الconventional intermedullary interlocking nail, showing the superiority of expert nail on treatment of proximal and distal fracture. The aim of treatment to reach the acceptable outcome of reduction of the fracture, which are axial alignment أقل من 5 degrees varus or valgus, anterior or posterior angulation أقل من 10, وروتيشنال mal alignment أقل من 10, الشورتنينج أقل من 1 سم، والكورتيكال oppositioning أكتر من 50. التكنيكس of internal fixation في conventional open reduction، المينيمالي invasive اللي هو الميبو، والاكسبرت تيبيال نيل. في سمبل ستادي معموله عندنا في القسم المقارنه بين الكونفنشنال اوبن ريدكشن والميبو كانت معموله على الاكسترا ارتيكولار تيبيال نيل 40 عيان 20 ايتش جروب. وجد ان بوث الاورف والميبو تكنيك are valuable in treatment of expert tibial nail, and الميبو may have long operating and fluoroscopy time, but it has the advantage of less bleeding and minimal wound complication. Our study of 40 patients with extra-articular tibial fracture treated at our hospital in July 2023 to August 2024. Patients were randomly divided into two groups, Group A, expert tibial nail, Group B, الميبو. الريزلت كانت ان جروب A كان التايب A1 كان 10 كان 10 حالات في الجروب جروب A و9 حالات في جروب B، و A2 5 حالات في جروب A و9 حالات في جروب B، و A3 5 مقابل 2. ودي نفس او similar to the parameters of Jovanix study and Wintergreen study. The operative time, there's no significant difference between the two groups, and this is similar to Wang study 2017. According to the range, we compared between the two groups pre-operative range on the intact limb pre-operative and post-operative of the fractured limb. We found that no difference between pre and post-operative range of the ankle joint. According to American Orthopedic Foot and Ankle Society score, there were no difference between two groups, and this was similar to JO 2010. Union time, Group A was found that Union time بيحصل على 15 أسبوع as average، والجروب B على 20 أسبوع as average. This was similar to Rodriguez and Jahangir 2023. A result, the case 1, male patient 45 سنة، A2 دي البروبراتيف اكس راي، ده على 16 اسبوع بدأ اليونيون، وده على 24 اسبوع complete union. دي كيس 2 ميل 30 سنة، A2 بريوبراتيف اكس راي على 20 اسبوع بدأ اليونيون، وعلى 24 اسبوع الكومبليت يونيون.
دقيقة واحدة بس.
Our conclusion: this study suggests that both expert nail and MIBO are effective for treatment of distal extra-articular tibial fracture with each method providing specific benefits. Expert tibial nail was associated with faster bone union. There was no significant difference in alignment and infection rate, ankle stiffness, or implant failure between the two groups on the short term من 6 شهور لسنة. And both achieved similar functional outcome based on American Orthopedic Foot and Ankle Society scores. We recommend future studies involving larger sample sizes for improved statistical power and generalizability with extended follow-up to assess long-term outcome and complications. Thanks.
شكرا جزيلا دكتور محمد سمير.